Hello parents, today we will be discussing a common problem among adolescents that all of us have heard of, anorexia nervosa. Anorexia is an eating disorder that is characterized by abnormally low body weight, an intense fear of gaining weight, as well as a distorted perception of weight. It is well known for having the highest mortality rate of any mental disorder. What is not well known, though, is that a third of deaths caused by anorexia result from cardiac abnormalities. And this is why we will be focusing on that today. One of the three most common cardiac abnormalities that occur in those with anorexia is sinus bradycardia, which is a serious condition that could potentially cause sudden cardiac death. As you can see here, a normal heart has a heart rate of 60 to 100 beats per minute. However, a heart with sinus bradycardia has a much slower heart rate of less than 60 beats per minute. This occurs because the body is desperately trying to conserve energy by slowing down the heart. The slowing of the heart greatly decreases the amount of blood that's being pumped out to the body. And because of this, not all parts of the body can get all the nutrients or oxygen that they need. The second most common cardiac abnormality in those with anorexia is mitral valve prolapse, which is when one of the flaps of the valve is not closing properly and instead it's bulging backwards. This is an example of the heartbeat that would occur in someone with mitral valve prolapse. That odd clicking sound you hear is caused by the flap bulging backwards. This often develops into mitral valve regurgitation, which you can see here in the next video. Here you can see that the blood is beginning to partially flow backwards, when in actuality it should only be flowing one way. This can result in fatigue, chest pain, dizziness, and even difficulty breathing. The third and final most common cardiac complication associated with anorexia is hypotension, which is when a person's blood pressure is consistently less than 90/60, which is much lower than the normal value. Hypotension in those with anorexia may be caused by malnutrition, weakened heart muscles, or dehydration. What many don't realize is that hypotension is just as serious a problem as hypertension. You see, hypotension can cause fainting, nausea, blurred vision, and in extreme cases, shock. In those with anorexia, it has also been seen to cause a 30 to 50% reduction in the left ventricle mass. Since it is the left ventricle that is responsible for pumping oxygenated blood out of the heart, this can once again result in the rest of the body lacking the nutrients and oxygen that they dearly need to function properly. Anorexia has many warning signs. Among them are extreme dieting and excessive exercise, which may result in sudden and severe weight loss, constant fatigue and difficulty concentrating, as well as dressing in layers to either hide their weight loss or to stay warm. If you notice any of these signs or symptoms in your child, here are some numbers you can call. The National Eating Disorder Information Center at 1-866-NEDIC-20 or the Kids Helpline at 1-800-668-6868. You can also go to these websites for more information. Ontario Community Outreach Program for Eating Disorders at www.ocaped.ca or Hopewell Eating Disorder Support Center at www.hopewell.ca. Thank you for listening, and I hope this video was informative. To cause a 30% difficulty concentrating, as well as dressing in layers to either I lost my voice halfway through.